hi everyone. So today we have webinar on antibiotic stewardship. Right? So before going to start the webinar, I just give the introduction about the company. Okay, we are 18 years old company focused on planning, designing, also doing quality accreditation for the hospital by doing NABH and JCI. And sorry, I'll give my didn't give you introduction. So I'm the Meet Core team leader from Astron Institute of International Study, Gurgaon, and we are offering 50 plus certified and diploma programs for nurses and paramedical technicians, adopting a blended approach with major focus on practical learning through on-job training. Right now, more than 10,000 plus nurses are certified and well placed at national and global level in reputed organization with the NABIT, ISO 17024 and Skill India. That's now we are training partner with Skill India. So now I would like to introduce our expert, Dr. Amandeep. Here he is a current administrative head in ANG Health Solution Private Limited, former administration head cum digital advisor at EMBABO, worked as a clinical quality head at SMO Group at Amandeep Group of Hospitals. So now over to you, sir. You can start the webinar.
So the topic for today is antibiotic stewardship. Because because we all are from the country where antibiotic usage is very rational. Because if we are having fever, we go to doctor and call, give me amoxicillin, give me a ciprox and paracetamol. So these kind of things are ultimately benefiting us for a day or two, but ultimately they are harming us for the whole life because our body is getting resistant to those drugs which are taken unethically and unapproved and unprescribed by a doctor. So this is the main reason the antibiotic stewardship program was launched, to reduce that kind of risk and incidences. So there are few definitions. Wherever we are using the word antibiotic, it is a drug which is used to treat the bacteria, not all the infections. For fungi, we have antifungal. For parasites, we have antiparasitics. For virus, we have antivirals. So antibiotic is a drug which is given for the treatment of the bacterial infections. Stewardship is the supervising and managing something and carefully attending by the responsible management of the drugs, though the drug is prescribed by the doctors, but they are to be counter-checked by the supremo of the hospital or the organization to see whether that particular drug is given within all the norms, though the checklist criteria has been followed. See, sometimes we see a patient was given Gramoseph, and on the day two, he or she was given piperacillin and tazobactam combo, or maybe meropenem, imipenem, the class 1, class 2 antibiotics. So these kind of transitions, whenever are occurring in any of the patients, they are to be supervised by the senior person of the organization who will see and approve whether this kind of change is really required or it is just been done to reduce the TLC count for 5 days. So the whole word antibiotic stewardship is an effort to measure and improve how the antibiotics are prescribed by the clinicians and how the particular drugs are being used by the patient and given by the nursing staff while the patient is admitted in the organization. In a clinical word, antibiotic stewardship program, it appropriate uses of antibiotics, improves the outcomes in the patients, reduces the resistance of the microbes, and decreases the spread of the infections which is caused by the multi-drug resistant organisms, which we'll read afterwards in the coming slides. So the stewardship program is a collective set of methodologies which are used in order to enhance the appropriate antibiotic use and reduce the harmful effects of the antibiotic usage. Harmful effects such as some antibiotics can have some ill effects on the kidneys. Some are hepatotoxic drugs which can harm our liver. So these kind of harmful and ill effects can be reduced in a better way by prescribing the rational dose of the antibiotic for the patient. Sometimes we've seen a person is taking medicine on the local quacks, but he's having multi-organ failures. These are the reasons for such kind of organic failures. So it also includes the awareness to the related aspects of the antibiotic resistance, toxicity, and economic burden, because the patient is paying from the pocket. If a patient is not paying, his or her insurance company is paying us. But unethical prescription of the medicine can lead to economical damage of the society and the country both. So this can be reduced also with this. So I guess though you all are infection control nursing enrolled students, so you most of you are nursing in the early years, or maybe you have done your internship in the hospital setups. Sometimes you have seen the patients where antibiotics are given as per the norms. But sometimes we might have seen the antibiotics are not given as per the norms. They are given rationally by the local EMOs because EMO doesn't know the detailing of the antibiotic. He prescribed a patient was coming with fever day before yesterday and consultant has prescribed him tazobactam. But the reason for the prescribing tazobactam by the consultant is different from the EMO. So these kind of usage can be reduced. So the purpose of the annual stewardship program include optimization and proper use of antibiotics in order to ensure the clinical implications and reduction of the harmful effects like side effects on the multi-organs, to make the cost-effective antibiotic usage, to maintain the quality patient care, to reduce the collateral damages in case of multi-drug resistant microbial infections, and to prevent the generation and spread of the resistant and antibiotic resistance in the patients. In simple words, the more antimicrobial agents and antibiotics we are using, and the highest is the resistance for those particular antimicrobes. Because microbes are getting enhanced. Like we are getting educated, we are upgrading ourselves. The same way is microorganisms. We are giving the antibiotics. Their body has some kind of chemical reactions. They develop the immunity against such kind of antibiotics. So they are kind of become resistant to the antibiotics. So when that particular antibiotic given for the next time, the bacteria is super intelligent. He can fight with that antibiotic and he won't let the antibiotic give good effect on the patient's body. Antibiotic resistance program has 5 R's, which include the responsibility, reduction, refinement, replacement, and review of those things. Responsibility is of the consultant and the person who's supervising, the nursing staff who is giving the medicine, the pharmacist who is handing over the medicine to the patient. So everyone has some kind of responsibility. So whenever we are using antimicrobial agents, we should take actions which will reduce the risk for future public health. That is why ASP has been launched. We have to reduce the resilience for the antimicrobials. And we have to find the ways in which we can do the reductions. Refinement, that 12 hours of the drug administration are being followed. Right dose, right drug, right patient, right time, right reason, right evaluation, right assessment, right identification, and right to refuse, and right education and assessment post administration of the medicines. So all 12 rights of the drugs administration should be taken care while giving any kind of antibiotics are being followed or not, and the refinement can be ensured by them. Sometimes we are supposed to add some antimicrobial products which will promote the good health. For example, whenever coronavirus had spread, we are not giving antiviral therapies to all the patients. We are giving some antibiotics. And after 2 to 5 days of the course of the antibiotic to the stage 1 patients, we are starting immunobooster drugs which will build the immunity to fight against such things. We are replacing the antibiotics with immunoboosters. And last but not the least is a review. We should be critical for the antimicrobial agent which are being used by the organization, by any of the consultant, are being used with the right strategy. ये नहीं है कि हमने एक एंटीबॉडी देना है जी, हमें वेंडर से पैसे आ रहे हैं, ऐसा अप्रोच नहीं होना चाहिए. Next, the core elements, leadership and commitment. If the organization is determined and dedicated, then ASP will grow. Otherwise, if the leadership commitment is not good towards the patient, towards the financial impacts, towards the information technology resources, it may lead to downfall of that ASP's projections. Accountability. A single leader must be appointed for noticing the program outcomes. As I've told you, any consultant can prescribe any antibiotic, but the senior-most person of the organization, being the medical superintendent or a senior physician or a senior senior consultant or a super specialty consultant, can be held accountable to counter check all the antibiotic prescriptions are being done in a right way or not. Drug expertise. Sometimes a consultant might be on leave for 2 to 3 days but a single pharmacist should be there and he should be appointed to monitor whenever my antibiotics which are being used. A slips comes with the name of imipenem, meropenem, vancomycin, linezolid or other high-end antibiotic, he or she should make a list of those drugs and he or she should go to the nursing staff and counter them. Ma'am, what are the reasons? What are the lab values of the patient like LFTs, RFTs? So that he or she can also intervene. So clinical pharmacologists are required for such kind of supervision programs. And whenever we are supposed to do the actions, the recommended actions should be implemented then and there only. It is not like that we should wait for the doctor to be aware of it in the future outcomes. हम लोग 3 पेशेंट का टेस्ट करेंगे फिर सर से डिस्कस करेंगे ऐसा नहीं है. We should go and rectify the things in the first level only. We should not wait for multi patients who suffer from the same issue. Tracking of the things, the antibiotic prescription, antibiotic resistance must be tracked, monitored, and recorded. So whenever we are having those kind of antibiotic, which are the high-end antibiotics being given to any patient, we should have a separate form of indicators. Like if we are giving imipenem or meropenem or tazobactam to any patient, they are more prone to get the deranged RFT values. So in such patients, what we do is when we add such antibiotic in the patient's file, a doctor must document the reason of the antibiotic prescription, then the dosage, route, frequency, strength, everything should be there, and for how many days the medicine should be given, it should be documented. And then at the last, he should write down RFT every second day, CBC every third day, LFT every fifth day, so that antibiotic can be tracked. Whenever the antibiotic is starting its ill effects on the patient's body organ, that antibiotic dose should be reduced, or the antibiotic should be eliminated and started with some other therapies which can enhance the recovery. Reporting will be done by all the levels. If a nurse is seeing it, I am seeing a treatment chart being written by a doctor in which a high-end antibiotic is written, I should raise the question why. Because if we not have a habit to ask why to the doctors or to the EMOs, the antibiotic stewardship program will not run. So a nurse should be empowered enough to raise his or her voice against this kind of antibiotic prescription. Though she can ask, but she will get a justified answer, then she can give it. If it's not justified, she can raise it to the person who is the accountable person, like a senior person. He said, I have seen this medicine being given by a doctor, but he has not documented the reasons for the antibiotic prescription. What should I do? Then the doctor will take the decision and give some kind of penalization for those persons who are doing some malpractices. So for that, education of the consultants, education of the pharmacists, education of the nursing staff, and most importantly, education of the patient is necessary because the patient can ask, "Na, why I am getting RFT every second day? I don't have a kidney problem." You should tell him or her, "Sir, this antibiotic has some effects on kidney, but such kind of effects will be monitored by us to reduce the ill effects. But this antibiotic is needed for your body for the antibiotic treatment." Next. These are the things which are we supposed to do. Because whenever we are prescribing the antibiotics, we are seeing positive blood, urine, or stool cultures or the fluid cultures on the basis of which we decide which antibiotic should be given. Drug bug mismatches, duplicate anti-infective agents can be seen, protected anti-infective agents can be seen, potential de-escalation opportunities can be seen, track the antimicrobial utilization, monitor the changes in the hospital resistance patterns, the antibiogram, because we might have seen sometimes earlier in our cultures of the hospital, which we are taking from the critical areas, we are seeing the samples which are positive for a basic level of infective organism, which can be E. coli or Enterobacter or something. But within some span of time, that Enterococcus and these kind Enterococcus histolytica or E. coli are being replaced by the Acinetobacter baumannii or the superior infective agents, which are being treated with superior antibiotics. And these antibiotics should be added in our antibiograms because every organization have to make their own antibiogram because whatever we are cleaning, whatever we are doing, there is some chance of contamination in the instruments, right? Because air is getting there inside everywhere. Because in a person we are whenever going to the OTs, we might find some kind of infection in the OTs. Every infective agent can be monitored by every organization in a positive way, so that the right infective organism can be tracked, and that organism is to be treated with which antibiotic it is shown to us through the cultures taken from those particular areas at regular intervals of time. Next slide, please. As I've discussed multiple times before. Antibiotic steward can be anyone and everyone from the organization. It can be the person who prescribes it. He should prescribe it in the right way, whether it is really necessary and how long it is necessary. Next, clinical team who use an antibiogram, that is an infection control nursing, infection control officer or microbiologist, because they are the one who guide us for the proper cultures, now how to take a culture. Sometimes a culture is being taken from a very sterile area, it comes sterile. It doesn't mean the culture is sterile. The mechanism is wrong to take the culture. So we have to take the cultures in a right way. So infection control nurse and infection control officers are equally important and they are antimicrobial steward as well. The EMOs who are on the ground on the daily basis because the consultant write their order on day one. Those all the orders are being followed by the treating persons and other supportive doctors and the nurses on regular basis or not. Are the reports being shown to the doctor at regular intervals or not? And the pharmacist who can ensure that the drug dose and duration, whether it is appropriate or not. If the pharmacist find out if that drug is being used for 10 days, he or she can raise an alarm to the prescribers and to the person who is monitoring that drug. Sir, that drug is being given for 10 days. There is a question mark. Are we supposed to change it? Are we supposed to do some test? Are we supposed to reduce the dose or something? So this is the responsibility of the pharmacist as well. So he can be antibiotic steward as well. Next. Kindly mute yourself for 10 minutes, please. Miss Malika Kudat, please mute yourself. Sorry. Antibiotic resistance. The words are describing it in a simple way. When antibiotic is given irrationally to the person without being proper evaluation of the particular victim and the clinical condition of the patient, the antibiotic may lead to the resistance of that particular antibiotic in the body. Because what happens is whenever we are taking antibiotics as without our any consultant's orders or just rational usage नहीं हो रहा, so what happens is antibodies जो हमारे antibodies release हो रहा है, that kind of get detected by the microbials. The microbes detect such antibodies and they remodel themselves. They उनके अंदर भी gene remodeling होता है, वो भी upgrade हो जाते हैं. So what happens is एंटीबायोटिक सिप्रोफ्लॉक्सासिन हर बार एक ही अपना एंटीबॉडी रिलीज करेगी. वो अपना एंटीबॉडी रिलीज बदल बदल के नहीं करेगा बिकॉज इट इज अ वंस मेड थिंग. नॉन मेड थिंग है विच इज गिवन टू अ पर्सन बाय द मैन्युफैक्चरर. इट इज ईटन बाय अस रेजिस्टेंस के लिए. उसका एंटीबॉडी आ गया. अब जो माइक्रोब बॉडी के अंदर है वो उस एंटीबॉडी के साथ अपनी कपलिंग करने की कोशिश करेगा. तो विद टाइम कुछ बैक्टीरिया मर जाएंगे, कुछ डीनेचर हो जाएंगे, बट कुछ बैक्टीरिया अपने आप को टाइमली मॉडिफाई करके उस साथ एक कपलिंग कर लेंगे जिसके से क्या होगा उस पर्टिकुलर एंटीबायोटिक से रिलीज होने वाले एंटीबॉडीज उस बैक्टीरिया पे असर करना बंद कर देंगे. एंड दैट इज व्हेन द एंटीबॉडी रेजिस्टेंस स्टार्ट्स इन द बॉडी. And that point of time what happens is these infections will not get treated easily with basic antibiotics. We're supposed to start the high-end antibiotic, and high-end antibiotics, it harms the pocket of the person, it harms the body of the person. तो दोनों नुकसान हो जाते हैं. शारीरिक नुकसान भी होता है और फाइनेंशियल लॉसेस भी होते हैं. तो दोनों लॉसेस को बियर कर पाना बहुत मुश्किल हो जाता है. The causes of antibiotic resistance in the body. First, overuse and irrational use. Next, misuse, spontaneous resistance, and the transmitted resistance. Because whenever we are taking antibiotics without the approach, they can give us resistance against that antibiotic. We have discussed it multiple times. I'm just clubbing it short in a very simple words. I need ciproflox for 3 days. I took it for 7 days. After 3 days, bacteria will get intelligent. He will start getting coupled with that particular antibody released by the antibiotic. So this can lead to the resistance of the antibiotic. Misuse. Misuse is that I take antibiotic on day 1, but I forget to take it on day 2 because I'm feeling very healthy. I don't take the medicine on the day 2. Then what happens is bacteria was given some sort of harm. उस harm उस हार्मफुल सेल का हेल्दी पीरियड सेल का कॉम्बो होगा और उस बैक्टीरिया के अगेंस्ट रेजिस्टेंस आ जाएगा, because bacteria take it as an opportunity and an advantage. Because if you forget to take one or more antibiotic doses and that stop the treatment without the prescribed dosage and the duration, bacteria start reproducing itself. And whenever they are multiplying, they are getting mutations as well. Because the first dose which was given to the patient was having some sort of negative effects on the bacteria. But those negative and the healthy cell will combine with each other and become resistance. Next is spontaneous resistance. Sometimes what happens is genetic makeup, the DNA of the bacteria changes or mutates on its own. जैसे हमने देखा था in case of COVID-19, because उसके अलग अलग variants आते जा रहे थे धीरे 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 धीरे. So they are getting changed with time as well. So next is transmitted resistance. Transmitted resistance में multiple parameters are involved. The first is our barrier nursing care. If the barrier nursing care is not being done properly, then transmissions from the contagious drugs and bacterial infection of someone else are very common. So that is why barrier nursing is very much important. And whenever we are treating such patients which are given high-end antibiotics and are having notifiable diseases, they should be isolated from the other normally ill patients. Because what happens is as the time passes on, the bacteria will getting resistance against that particular drug which is given to him, because he is getting spread from the other organisms which have been kept nearby, because it's a transmission of the bacteria from one person to other. That is why two things are important. First is barrier nursing, and second is the moments of hand hygiene should never be forgotten at any interval of the time. There are 5 moments which are being followed: before touching patient, after touching the patient, before a septic or clean procedure, before any body fluid exposure, and after touching any patient surroundings. Next. Because these 5 moments can be followed, which can help us in reducing the transmission of the antibiotic and the microbes. Next slide, please. First, we are supposed to identify who are at the risk for antibiotic resistance. We have already understood that antibiotic resistance can occur by the transmission also. So for transmission, we're supposed to identify the person with a major risk, which include the babies, especially the preterm borns, adults who are above the age of 65, the people who are living in the homeless conditions, immunocompromised patients who are having severe illnesses like cancers or HIV or some other things, and people who have taken antibiotics for the long duration. So such kind of patients are at the risk to get the antibiotic resistant, and such patients are to be treated isolatedly from others. There are few basic bacteria which are getting the antibiotic resistance, which includes सबसे common है हमारा E. coli, then Staphylococcus aureus, Klebsiella pneumoniae, Streptococcus pneumonia, Acinetobacter baumannii, Pseudomonas aeruginosa. There are a few more bacteria which are being the multi-drug resistant organism, which include methicillin resistant Staphylococcus aureus, because Staphylococcus aureus when treated with methicillin develop the resistance against methicillin and become the methicillin resistant Staphylococcus aureus. Then Mycobacterium tuberculosis, which is a multi-drug resistant dosage, which is because we are treating the tuberculosis with some sort of antibiotics, but then we are getting intelligent with time and getting a multi-drug resistance. And last but not the least is vancomycin resistance enterococcus and enterococci. And other is the STDs जो हमारे होते हैं गोनोरिया से, वो भी रेजिस्टेंस के आने पर ड्रग रेजिस्टेंट गोनोरिया बन जाता है. So these 4 or 5 antibodies should be treated in very effective and positive approaches, so that the multi-drug resistance can be reduced to the maximum. Next, how can we combat antibiotic resistance? See, the hand washing is very important because hand washing is the primary source of contamination at all the levels. So healthcare providers and policymakers must do a good amount of the heavy lifting to change the things on a global scale. It doesn't mean you are powerless. There's a lot you can do, like few tips which include number one, good hygiene. ये कैसे होगा? Nursing को बार-बार encourage किया जाए to perform the 5 moments of hand hygiene. In our organization, what we were doing is we were raising an alarm every hour. Hand washing time, hand washing time, hand washing time. So every nurse will go to the counter and clean her hands once every hour to reduce the risk. And the 6 steps of the hand hygiene should be displayed at every nursing counter so that no nurse will get any sort of step का skip होने का reason. All steps should be followed strictly for hand washing. So the hand washing step should be pouring the soap. The step 1 is removing all the jewelry from your hands. You should be with clean hands and short nails. trimmed nails, you can say. Apply a soft little amount of soap on your hands, palm to back of hand, finger cross leg, fingers interlaced, rotational cleaning of thumbs, and last but not the least is the tip cleaning. Next is vaccination against the infective organism which are being given. There are few infections which can be controlled if the vaccines are taken on time. Because such kind of vaccines taken on the right duration and the right age will spread the infections and reduce the risk of such infection in the future. Someone has raised a hand from Samsung SM. It's a request. The session is about to finish in next coming 4 or 5 slides. I will take your question in the end. So please bear with me for 5 minutes. Or if it is really urgent, you can ask it.
We can take the question at last. We can take the questions at last. Please down your hand. Sir, you can continue, please.
Okay, thank you very much. I have told it many times, antibiotics should be taken whenever we are needing them for the real. So it's a simple thing. Always take medicine after being prescribed by a certified doctor. Only don't take the antibiotics from the local quacks or the RMPs. They are giving the antibiotics as per their experience that they're treating with same antibiotic for past so many weeks or so many years. But it is not the ethical, the real practice. The real practice is what we are reading in the journals, because our MBBS doctor and the RMPs have different amount of knowledge, and with that different amount of knowledge, we can treat the things in a different and a better way. So always get treatment from the certified doctors only, because they know the things little better than others. Next.
Sir, next slide.
Yeah, please. तो एंटीबायोग्राम्स कैसे बनते हैं, ये मैंने लास्ट में 3 स्लाइड्स रखे थे, इसको हम एक्सप्लेन करते हैं. We took the samples from the patient. Sometimes what happens is our nursing hand hygiene is not that good. She is not taking 5 movements. She is not doing barrier nursing, wearing gloves and masks whenever handling such patients. So a nursing staff can infect her patient sample sometimes. Or maybe a patient is previously infected and coming to us. We take the sample of the patient to find 2 things: the isolates of the microbes and the susceptibility of the antimicrobes which are being having in the blood samples which are being taken by the person. So what happens is we take a sample of a person and send it to the lab with proper sterility. Then microbe isolates are being done. Then the personal susceptibility is calculated by the lab team, and then they verify the data and share the report with us by testing the particular microbe isolate with many of the antibiotics. And then after the month, the whole clubbed data of all the patient sample is being presented to the infection control committee. Then the antimicrobiogram, if need any kind of changes, can be changed. And if the surveillance of the nursing team should be encouraged, that nursing is doing some wrong practices in the patient care, that things can be identified and monitored and surveillanced by the team. And these should also be reduced, and remedial measures can be taken to reduce the infections. And antimicrograms are getting reviewed and replaced by the new ones, which are being shared by the lab persons. Next. Slide change करिएगा please.
Sir, next slide.
हाँ जी. So this is a way a report is being shared. Maybe other organizations have other kind of report sharing. They find out organism. They have a classified list of the antibiotics which are being tested, and the MIC value is being noted. And after the MIC value data, we find that which is the best suitable antibiotic which can treat a particular infection in the human body. So then how our antibiograms are being reviewed. We take such samples of the patients, and we take such samples from our environment also to plan our antibiograms. The annual antibiograms are being prepared in same way. The more is the MIC value, the more effective is that drug. The less is the MIC value, the less resistance is against that drug. Next, please. Slide change करिएगा please. Next slide, please.
Yes, sir. Please continue, sir.
Yeah, I just want you to change the slide because this is just a template to share that how microbiograms are prepared, because it is just a demo that we test a sample in which 10 to 12 organisms are being found, and then antibodies are being tested, and then if choose the best antibody, the green one, the above the efficacy above 90, the MIC value above 90 are the drugs which are being better for the treatment of such kind of infections which are being found in the patient sample or the environment sample. So that how antimicrograms are being prepared. So this is a sample. So this is for ICNs. They should take the samples in an effective way, and the lab team should make the report on different antibiotics and different organism being found in that particular sample. Then there is a real effectivity of the antibiogram. Otherwise, antibiograms just making for the courtesy sake कि एक फेक रिपोर्ट निकाल के इकोलाई पॉजिटिव कर दो और हम एंटीबायोग्राम बना देंगे, वो कभी भी जस्टिफाई नहीं करेगा आपकी चीजों को. यू शुड मेक द ऑथेंटिक एंटीबायोग्राम्स ऑन द बेसिस ऑफ द प्रॉपर टेस्टिंग, the proper cultures to be done. So now I'll take all the questions. The presentation is being finished.
Yes.
So whosoever is having a question, please raise your hand and mute yourself one by one after I will pre-announce your name. Otherwise, it will get a confusion to us. So first question I will be taking on the person who has raised his voice. The Samsung SM something was the ID. Please unmute yourself and raise your question.
Please raise your hands.
Yeah, Sonali Mahajan, बोलिए.
Yeah, Sonali Mahajan, please tell.
Hello, sir. Good evening.
Good evening.
How are
Sonali,
you?
Sonali, your voice is very low.
Yes, it's audible to you now.
Yes.
Yes.
Please carry on.
A very good evening, Aman sir. It's a very small world and we meet here.
Yeah, it's nice to see you here. She's the old colleague of mine. She has worked with me.
Sir, my question is that what quality measure we take to improve the quality ensuring infection control in a hospital to reduce the risk of infections and implementation of the good antibiotic policies. Can you tell me?
See, there are three parameters which are taken in loop always while for the patient care. First is the environment. If follow the proper cleaning methods, proper cleaning agent, and proper training of the employees,
Okay.
sterilization of all the equipments being used by the patient, proper patient surrounding area, the patient bed, and other surrounding area which are not that critical but non-critical, these areas should be cleaned with accurate chemicals at regular intervals of time to reduce the infections. First is this, the environment cleaning and environment planning, environment handling. And second is the quality parameters, which include is the nursing. Nursing should follow all the moments of hand hygiene at all the levels to spread the infections to the patients. So second is the nursing care. The moments of hand hygiene and steps of hand wash should be encouraged more and more to inculcate in the blood. And barrier nursing care, the cap, mask, and gloves should be worn at the time whenever needed.
Okay.
And last but not the least is the ICN. He or she has to make a round in the whole hospital to see the malpractices being done, identify those things as a fact-finding practice, not as a fault-finding. So just take the fact that I am seeing 10 nurses today, 7 were doing the hand hygiene in the right way, 3 were doing the wrong way. And those 3 nursing staff should not be penalized, but should be trained for at least coming 2-3 weeks. Because whenever with ICNs are going on rounds, they are starting to take the fault finding, and the fault finding will make the 7 count to the reduce to 3. So these kind of practices should not be encouraged by me. We always believe in fact finding because
Okay.
facts will help us to improve. And last but not the least, all the samples should be taken with proper sterility, because if the sample is not taken in a proper way, the culture will get positive and the whole process which is being done is being deviated to other things.
Okay, sir, it's nice to had a words with you. Thank you, sir, and your observation, and let me be in my whole education journey, sir.
Thank you very much, Sonali. Thanks for
Thank you, sir. Thank you, sir.
nice meeting you.
Sir, there is a one question from Pavitra. So, what is the time duration for the bacteria to get the resistance of a particular antibiotic?
See, we can't define the duration of the bacteria because some bacteria, because देखो ना, एक बैक्टीरिया के अगेंस्ट हम कुछ भी एंटीबायोटिक देते हैं, हर एंटीबायोटिक का अपना एक हाफ लाइफ होता है. Every drug has its own half life, and the half life of the drug is the thing which determines any antimicrobe can have a mutation at any time whenever the drug is not being eliminated from the body. So resistance can occur at any interval of time, maybe after 3 days, maybe after 7 days, maybe after 7 weeks, maybe after 7 months. But the real thing which we are supposed to do is to take the rational antibiotics by the right persons. बिकॉज अब मुझे पता है कि मुझे एक एंटीबॉडी कितने दिन खाना है और कैसे खाना है, मैं वही प्रिस्क्राइब करूंगा और मेरा स्टाफ वही डोज लेगा, उसके बाद वो बंद करेगा, लेकिन मुझे दिखाएगा. तभी हम डॉक्टर्स एंटीबॉडीज बंद करने के बावजूद बोलते हैं ना फॉलो अप आफ्टर 7 days, ताकि एक हफ्ते बाद मरीज आके मुझे दिखाए, मुझे कुछ टेस्ट करवाने, आई शुड गेट दोस टेस्ट डन टू सी दैट if the resistance is being shared or not. अगर resistance मुझे indicate होएगा तो I might prescribe some other medicines to reduce the resistance.
Anyone else? Ma'am, sir, one Sarita
There
is
is a
here.
question by someone. A person wants me to share the last year microbiogram. There
Yes,
is
yes.
nothing in antimicrobiogram, ma'am. This is normally, मैं हिंदी में बता देता हूँ. हम लोग क्या करते हैं, अपनी हवा का कल्चर लेते हैं बंद कमरों से, जो हमने स्ट्राइल किए होते हैं एक बार अपने फ्यूमिगेशन के बाद. उनको अनफ्यूमिगेट करने से पहले उनके सैंपल्स लेते हैं, ओपन करते ही विद स्टाइल हैंड्स एंड ऑल द सॉफ्टवेयर प्रैक्टिसेस. उसके बाद हम देखते हैं कि हमारी हवा में कितनी कंटेमिनेशन थी, जो सैंपल में पॉजिटिव आएगी, और उस सैंपल की एक रिपोर्ट आती है हमारे पास कि आपकी थी हवा के सैंपल में हमें एसिनोबैक्टर मिला है, जिसपे सिप्रोफ्लॉक्स ग्रामोसेफ वर्क नहीं कर रही, लेकिन सल्बैक्टम काम कर रही है, टेजोबैक्टम काम कर रही है. तो व्हाट वी डू इज कि व्हेनेवर वी आर हैविंग एनी पोस्ट ऑपरेटिव पेशेंट और इन्फेक्टेड पेशेंट विद अस, we treat such patients with tazobactam and sulbactam at the first level, because this sulbactam and tazobactam will treat the internal infections being the antibiotics, and will also treat the patient against the infection which he or she can take from the surrounding area which is present from the sample taken from that area. तो ऐसा कुछ नहीं, एंटीमाइक्रोब कुछ नहीं करना होता, सैंपल्स लेने होते हैं. उस सैंपल में जिस ड्रग का एमआईसी वैल्यू 90 से ऊपर जाता है, वो ड्रग्स हम चूज कर लेते हैं फॉर द ट्रीटमेंट ऑफ द पेशेंट फॉर नेक्स्ट 2 to 6 weeks. और 6 हम सैंपल्स दोबारा लेते हैं टू सी दैट हाउ द थिंग्स आर बीइंग इफेक्टिवली मैनेज्ड और नॉट. The common of all is E. coli and S. aureus. सोमनाथ जंगाम.
Sir, एक क्वेश्चन और है. Which is the most common bacteria cause hospital acquired infection?
E. coli, यूटीआई में E. coli सबसे बड़ा कंपोनेंट है. और हमारा दूसरा.
Anyone else have a question? No one have a question? Yes, please.
Hello, sir.
Yeah.
क्या है?
Sir, this is Pavitra. A small question. I am working in BMT. Basically, this is the bone marrow transplant where we treat like blood cancer patients. So, when a patient comes with the complaints of fever, our first line treatment would be a meropenem. So, like probably till we get the patient counts back, we'll be giving continuously meropenem and we'll get the patient discharged. Again, if they come with the complaints of fever, again we'll do the cultures and we'll restart the meropenem again. So, so I just asked the question. So, what is the time duration for the bacteria to get the resistance? Will that cause the multiple use of medication? Same medication will cause the resistance to the bacteria.
As you are working in a bone marrow center, which is a cancer treatment center, so we are kind of aware that whenever there is a cancer in the body, there is some variations in our DLCs, which is neutropenia, is very common, right?
Yes, yes, sir. Yes, sir.
So meropenem is the safest drug to be prescribed in such patients who have a low neutrophil count and has good resistance against all the microorganisms. So that is when meropenem is being used by most of the cancer patients as a choice of antibiotic on the first level always.
Okay.
This is only the reason. Might be you can also Google it. The real usage, why it is being used. The real reason is it is like neutrophils के साथ इसका बहुत ज़्यादा connection है. That is why it
Yes,
works
yes,
better on those.
yeah. Okay.
Any other questions, please?
Any other question, please? Okay, sir. There will be no more
Thank you very
questions.
much, everyone, and I hope you all become good ICNs if you're enrolled for the ICN course, or at least you should become good nurses who can help us in reducing the infections to our patients. So wish you all complete your course on time with good ranks. Hope to see you soon, someday, somehow, somewhere.
Hi, very good evening, Doctor. Thank you so much for the immensely innovative and immensely, the information that you have provided through this webinar. I think it was much needed for the infection control nurses and, of course, the BSc and GNM nurses who would like to know about antibiotic stewardship. Absolutely. And we when we started advertising, your the topic that you gave us, Dr. Amandeep, we got so many responses, that this is such an innovative topic, and thank you so much, Astron, for getting us through. And I'm sure that all the students who are present here, they themselves must have taken the best of it, and a lot of question answers have happened, a lot of queries have been sorted out. So thank you so much from Astron's end. Thank you so much, Dr. Amandeep, for your time, for your valuable time, for such an innovative presentation that you've given us, and looking forward for more such webinars from your end in the near future to come. So thank you so much from Astron's end.
It's my pleasure to be here to address the candidates on this, because it was really a very needed topic at the time, because many of the things are been happening around in the world, in the globe. So this resistance program has to be taught to the basic level so that they can object it at least, because they can become the steward in that. कि सर आपने लिखा क्यों है? जब ये क्यों आएगा तो लिखने वाला भी सोचेगा ना, मुझे बोलना पड़ेगा, तो मैं क्यों लिख रहा हूँ मैं बता दूं या मैं ना ही लिखूं इसको irrationally. So this is why I'm just empowering the nursing through this. That is why I chose this topic at the first level for the ICN training program. So I hope कि जो हमारा motive था वो clear हो गया. And there was one more question, that is spontaneous resistance. Ma'am, I have already shared na, sometimes applications in the bacteria can occur on their own. So these kind of mutations are being called spontaneous resistance, because bacteria खुद ही mutate कर जाएगा, तो spontaneously उस antibody के against resist कर देता, उस antibody पे काम नहीं करता. So that is the only reason. That is called spontaneous resistance.
Okay.
Thank you so much.
Thank you, sir. Thank you very much. Thank you very much, sir.
Okay, I'll take your leave. Bye-bye.
Thank you, sir.